First of all, I want to thank Dr. Wooten. We met yesterday, and I'm very impressed with what's been pulled together here in short order. I don't think we can put a big enough spotlight on this issue, and Dr. Wooten's been working overtime, I know, to do exactly that. But the job is enormous. I am still amazed as I go through the community that the community is aware largely that there's something out there, but I don't know what we have to do, and I know there are things being done to really light a fire, and I mean that in a medical sense, not in any physical sense, under people. There's awareness that there's a new type of flu, but there's still a casual attitude. It's like, it's flu. And if we can get a significant percentage of the people in San Diego County vaccinated, they will forever wonder why we were so concerned about this. But the numbers and the information that we have to date on the number of people that could die of this without a very, very aggressive program dwarfs any of the issues that we're talking about this year. It cost, as I learned yesterday, about $10 per person for us to get the vaccine out there. And if you do some simple math and assume that the private providers are going to be out there and they're going to be successful, and some people aren't going to be, in spite of our admonitions, aren't going to get their shots, there may be upwards of 1 million people left for us to get into the sort of the public clinics, if you will. And the amount of money that we're even talking about here today, while significant, may end up being half of what we will ultimately need to do a very aggressive public program. I was delighted when I heard about the PSAs that are going to be prepared and working with the TV stations to increase the outreach and to get that message out there. I don't think we can do too much in this. If we were faced with anything else of a similar nature, we couldn't have the positive effect for such small dollars as we could on this. And most of it is educating people to let them know, you've got to do this. I'm still amazed. I had discussions with some people this morning, and I said, the highest risk group is pregnant women. And, oh, I didn't know that. And women that are pregnant, I didn't know that. We really need to do everything possible. And when I mean we, I mean all of us in government, in the business community, and I think our representatives from the chamber and other groups have already left. But we need to do everything we can to drive this message. If we do, we will minimize the number of deaths. And if somehow we're not successful, this could be, for us, in more than recent memory, the worst year ever as far as flu is concerned. So I don't know how we can, every time there's a presentation, I want to see if there's something on the agenda, I want to know what's going on. I want the public to know what's going on. I want to do everything we can to drive this message. And as I say, it may be that we're going to have to come up with more money yet as we go through this to ensure that everybody that is willing to be vaccinated, we want to ensure that they are vaccinated. So Dr. Wooten and Nick, thank you for your efforts here, but don't rest. One final thought, I was just thinking, me being the only exception, all of my colleagues on the board have a background in education and have had a big interest in education. Dr. Wooten, yesterday, I can't remember the exact number of school districts that have not responded yet. It's about half that have responded, if I remember correctly, and half that haven't. But I didn't know if letters from the supervisors to the districts within their district to prompt them to get involved here, because that's our highest priority. Once you get past the pregnant women, those young kids are really at risk. And I think that for school districts not to be connected with us, so I would encourage, if, maybe all of us can do it, is to target the school districts within our areas to make sure that we have programs linking them